Hello and welcome to yet another episode of Hospital Survival. Guys, I know you all missed me. Calm down. I know, I'm here. I'm back in my recording space and I guess I have more episodes for you. So let's just jump right in. With these videos, I actually don't like adding a long intro. A lot of you complained about the intro. No, the intro is too long. No, I don't like the music. Okay. I heard you, okay? So, in this episode, we're going to be looking at 5 ways to know what you don't know during the clinical rotation. Imagine that. Medicine is the only course that I know of where actually students don't even know what they don't know. But anyways, let's just jump right in. If you haven't yet subscribed, please subscribe to the channel. Hit the bell notification icon to be receiving notifications of such videos every time I post. Tell a friend to tell a friend that we are back in full force and we are recording videos back on the channel. My name is Dr. Moses Kazevu for all those of you that don't know. And of course, let's just jump right in. So the point number 1 that is there is, of course, knowing the syllabus. I know. I'm like, why am I watching this YouTube video when this guy is pretty much telling me that I should know the syllabus? I mean, don't I know the syllabus already? No, that's not what I mean. It's one thing to know that there is a syllabus that exists, okay? Let me give you an example. Oh, 2 students chatting. Oh, have you heard of MK7's medical channel? Yeah, I've heard of it. What is it about? And it's just silent. They know of the channel, but they don't know what the channel actually does. You may know of the syllabus, but you don't know what is in the syllabus. So actually, the first thing that I would actually advise you to do is get the latest syllabus of your course. If you're studying medicine, get the syllabus for medicine, MBCHB or MBBS. If you're studying clinical medicine, get your syllabus for clinical medicine. Whatever medical course that you're studying, get the clinical syllabus. Now, you ask me, where can you actually get the syllabus? Well, if your school is accredited by the Health Professions Council of Zambia, then they should be able to provide you with the syllabus. If they're not, then report them to the officials. Anyways, you should be able to get a syllabus from your school. Your school should be able to provide you with the syllabus. That's the first and foremost important thing. If your school is not able to provide you with the syllabus, then of course your lecturer should be able to provide you with the syllabus. That's assuming that your lecturer is rather friendly and actually has your best interests at heart, because anyways, I don't want to go into that. So get your syllabus, know your syllabus. And how to actually utilize the syllabus is you can actually filter out the topics that you're supposed to learn. Focus on your academic year. If you are in first year, focus on first year. If you are in second year, focus on second year. If you're in third year, focus on third year. If you're in final year, focus on the final year. I mean, it doesn't make any sense if you're in 7th year, then you focus on 4th year stuff. That is like me going to focus on grade 1 stuff because I really missed the ABCs. That doesn't really actually make sense. So focus on your year. That's the first thing. So when you're actually reading through the syllabus, it gives you a list of topics and objectives that you must achieve at the end of the year. And remember that medicine is actually wide. You're not going to learn everything in medical school. You're not going to learn everything in whatever school you are in. It's very, very wide. So in this sense, what I'd advise you to do is actually filter out the topics and write them down on a piece of paper. Then during the academic year, make sure that you're ticking through those topics. You're making your notes, and after you make your notes, you tick through those topics. There are also a list of high yield lists that usually show up on the exams that are circulating all around. I think I have put out one of these high yield lists. Your lecturer may have one of these high yield lists. Whatever it may be, make sure that you tick all those topics as the year ends, because most of the times your exams are going to be based on those topics. Which now leads me to the second point, which is of course quizzing yourself after you after you study. So quiz yourself after you study. What do I mean? After you read a topic, you're laying in bed and you are ruminating or contemplating about your topic. Ask yourself questions. What did I read? The only problem with this is that you're in bed and you're thinking, what did I read? And the only thing you can remember is the title. Sometimes not even the title. You're like, what was I reading? You don't even understand what you were reading. You don't even remember the title of the book. All you remember is that, I was using a book to read, and I was opening a book and I was reading. But you don't know exactly what you were reading. If you find yourself in such a situation, it means you have to change your strategy. It means that how you were encoding that in your memory was really useless, because you're not able to remember. If you can't remember it 2 minutes after you're done reading, what makes you think that you're going to remember it 10 years after you're not reading, or 10 years with you not reading? And this is how memory works. Memory is more about repetition. The more you repeat something, the more it gets embedded in your head. Make songs, it's like, okay, fine, 2 7 9 10, 2 7 9 10, 2 7 9 10, 2 7 9 10. It becomes a vibe like that. To me, this 2 7 9 10, now I may be saying it, people may think I'm crazy, as in what is 2 7 9 10? But in my head, I know that those are the vitamin K dependent clotting factors. 2, 7, 9, and 10. Don't forget about my hand science. I don't know how to do my math apparently. So quiz yourself after you study. Then if you get half of the things wrong, or you can't even remember half of the things after you study, don't be stressed. All you simply have to do is change your method of encoding in your memory, change the way in which you learn these things, learn these concepts, change the way how you make your notes, because most people make really, really terrible notes. If you actually check those term papers that you guys actually write, you would actually realize that you guys are just actually rewriting the whole textbook. And you're actually missing the point. The point of you actually making your own notes is tailoring your work so that you can be able to read it and actually remember. I make my own notes, and the way I make my own notes is in the most logical sense, and that's why I think most people actually find it very easy to read through my notes, because it's in the most logical sense. If I'm reading a condition, guys, and I start off by first looking at complications, that doesn't make sense, because I don't even understand what the definition of this condition is. I don't even understand what causes this. I don't even understand if there's some relative, or rather some associated basic science that I need to learn, because let's be right, in clinical years, you don't actually learn or understand everything. They may teach you everything, but I think the time is too short. I think they should cut out some of these second year courses and we start learning some of the courses that actually do matter in medical school much earlier, so that you can actually get a feel of them and you can actually understand them even better. I would actually advocate for this, so that it actually makes third year and fourth year less bulky. If you already know what I mean, if you're in a fourth year student, if you are having that PTSD, my word. Anyways, let us not reminisce back on fourth year. So, actually, I even lost my train of thought. I don't even know what I was talking about. So you should actually make your notes in a logical manner. So what do I mean by a logical manner? When I'm writing my notes, this is the thinking process that goes through me writing the notes. The first thing that I ask myself is, okay, what basic science do I need to actually apply for me to be able to understand this concept? Suppose I'm studying about hypertension. I love internal medicine. It's my passion. I love it. So suppose I'm studying about internal medicine, I'm studying about hypertension. What's the first thing that's going to come to my mind? Okay, fine, I need to understand a few concepts. So I need to understand the concept of preload, afterload, total peripheral resistance. I need to understand the Frank-Starling phenomenon. The control of blood pressure is very central to hypertension. After I understand this, I must then now go and look at the definition of hypertension. If there's been any recent changes in the guidelines of what hypertension is, and by the way, there has been some changes. So if you're still sticking with the same hypertension is blood pressure over 140/90, and then you even start fighting your lecturer who's reading the newer content, that says a lot about you. So when you are studying, actually read up on the latest material. Go to Google Scholar. Some of you don't even know what Google Scholar is. You'll be like, what creature is that? Google Scholar is a website where you actually get the latest articles. You can filter them out based on whatever you're needing. And if you're actually very good at these search engines, you can actually fine-tune your search to actually get whatever you want. And Google Scholar is the best step for you to actually start understanding the newer things and the newer changes that are happening. For example, in hypertension, look at what the American New York Heart Association, the American College of Cardiologists, or whatever they call it, and see what are the new changes according to hypertension. Then after that, come to the causes of hypertension, how it's classified, the pathogenesis, the clinical features. Then you can even go to complications after this, how we make a diagnosis, how we manage these patients, and if there are any emergencies that are there. If you're studying in that logical manner and you're making your notes in that logical manner, of course you can cut out some unnecessary things that you don't need. For example, if they say the incidence of hypertension in maybe, let's say, India, for example, when you're in Zambia, that doesn't benefit you in any way because you're in Zambia trying to look for statistics that are relevant to Zambia. Of course, that doesn't mean that you should ignore what's happening in the world. You should also have some perspective of whatever is happening in the world as well. So if you actually structure your notes in this manner, it makes it very easy for you to actually remember. It makes it very easy for you to actually encode. And most of you students, actually, I don't even want to say most of you students, most of us, because I was also part of the same trap, we actually make these notes that we actually never even read. You write these notes and you're like, yeah, I'm going to read this. I'm going to read this. This is going to help me in the exam. Is it going to help you in the exam? Are you going to read it? I've never met anyone who actually reads those notes. If you actually read those notes, then you actually realize that your notes are actually quite good and you can actually use them to revise. The more you read them, the more you're going to be inclined to remember what is in your notes. And even when you quiz yourself, you're more likely to remember what was in your notes because it's in your own handwriting. If you don't want to quiz yourself and embarrass yourself in front of yourself, I know that's kind of sounds like a paradox, then get someone else to embarrass you, someone who you're comfortable with, the study buddy perhaps. Ask them, please ask me anything concerning hypertension. I am ready for you. I'm ready to impact some data on you. Here's a book. Ask me anything. Here are my study notes. Ask me anything from it. Then they ask you questions from that. That is the only way to know what actually you don't really know. Because if you can't really explain what you were studying, then I don't think you really know what you are supposed to know. So that brings me now to the third questions, or the third time is getting someone else to quiz you. The third point is getting yourself someone else to quiz you about the topic, getting someone else to actually point out what you don't know and what you need to know. I don't know. I'm checking down here to see if actually my thing is recording. I do not want to record this more than once. Oh yeah, it is recording. I do not want to record this more than once because I've had so many takes that I'm too embarrassed to actually admit it. So the third thing is get a study group, get a study buddy, go through topics and ask each other questions based on topics. Not necessarily past papers, don't get me wrong. I'm not saying go through past papers and start asking each other past papers at this point. No. Go through the condition and start asking each other questions based on the condition. I always used to do this with my study buddies when I was in medical school. We would sit down just after the ward round. Of course, attend all your ward rounds. Do not miss the hospital duties and hospital stuff. So we used to actually sit down and actually quiz ourselves. We called it as academic gymnastics, if you know what I mean. So during the same academic gymnastics, we'd ask each other, so, what did you study yesterday? What did you study yesterday? Okay, fine. This seems like an interesting topic. Let's quiz you on this interesting topic. Then we'll start to make interesting questions. For example, suppose someone says, okay, I studied about jaundice. Then I'll think, okay, younger man, is it possible for someone to present with jaundice and blindness? Then the other guy will be like, jaundice and blindness? Well, I think so. And I'll be like, okay, tell me why. By the way, whenever someone asks you, is it possible for something to present with this and this? It's just a trick question. Most of the times it is possible, but what they're looking for is the reason why you think that it's possible. And in this case, the reason why someone could present to you with jaundice and some form of blindness is if they have a vitamin A deficiency. Remember that vitamin A, D, E, and K are fat-soluble vitamins. But this is not a lecture. This is not a lecture. Calm down, boy. Calm down. This is not a lecture. So let me not get derailed. So get someone else to quiz you on whatever you have learned. Get someone else to actually ask you on these questions. That's the third thing. The fourth thing is actually going through revision papers, going through past papers, going through Quizlets. That's one way to know what you actually don't even know. So the first thing actually is go through the past papers and see what was asked based on hypertension. What questions did they ask on the MCQs, the single best answers, the true or false? What questions were asked if there was any matching? What questions that were asked if there was any one word answers? What questions were asked if there were any short essays? What questions were asked if there were any long essays? That's of course if you have a past paper bank, of which I actually want to actually have and achieve on my channel, where I get a lot of these questions from different sources and combine them, and so that you can help you think through the process of how you're going to be tackling questions, how you're going to be answering questions, because it's an art. Answering questions is an art. You don't just say, okay, the answer here is a B. Why is the answer B? Because it's B. Kuma and Clark say so. That's not the right way to actually do this. You should actually say that the answer is B because, well, if you look at option D looks like as if it's the opposite. If, for example, if you had someone that had jaundice, they wouldn't actually present to you with such and such a thing, because that's not a typical feature of obstructive jaundice. But then in obstructive jaundice, you have the typical feature of pretty much your dark colored, which is the scleroicterus. You have your itchy skin, you have your pale stool, which is of course fatty, and then you also have your dark urine. Of course, if this patient has obstructive jaundice, you wouldn't expect them to have normal colored stool, so that option is already out. So there should be some thinking that is there. And of course, when it comes to answering different types of questions, there are different types of approaches with MCQ questions, different types of approaches with essay questions, different types of approaches with true or false questions, because each of those has a similar pattern, and examiners actually know those patterns. And this is what examiners actually don't want you to know. If they find someone is actually teaching you how to beat the system, it's going to be awkward for all of us, but I'm not going to go into that. I told myself I'm not going to be drawn into this, so I will keep on track. So find questions that are relatable to the topic that you've actually covered, then answer those questions. You can answer them with a study, but you can first start off by answering them yourself. If you can't answer them, then go through the textbooks. That means that you're not yet ready for that topic, and reread. If your textbook that you're using is very shallow, then go through another textbook. I always get surprised, those people who say, no, I just read a PowerPoint. Anyway, you just read a PowerPoint and you want to survive an exam. Interesting. So don't be one of those people. Don't be a PowerPoint people. Those people are the laziest. Please don't be lazy. Go through at least 1 or 2 textbooks. Make sure you go through the standard prescribed textbook. Most people say that I haven't gone through the standard prescribed textbook. It's too big. It's too long. Go through the standard prescribed textbook. There's a reason why it's known as the standard prescribed textbook. Okay, go through it. There's a reason, because there are some things that they will ask you that are based on the standard prescribed textbook that other textbooks will not have. But of course, sometimes the standard prescribed textbook is one of those things that beats around the bush. You know, one of those shows where they give you like a history first before the show starts. In 1986, John was found on the railway in the morning at the Copper Belt railway station. I don't know if there's a Copper Belt railway station, but I assume there is. So if you have such a book, when are you going to finish, 1,900 pages, and then there's a book that's offering you 600 pages to learn the same content and actually possibly even pass the exam. I know the temptation, but actually make sure that you go through the larger textbooks, because the smaller textbooks, usually what they do is that they cut out some of the in-between information, connecting sentences, and if you're not the brightest apple in the basket, you may actually miss these connecting sentences and they may not make sense. You read the sentence and you are confused. This is how it plays out. You're studying in the exam. You're studying actually before the exam. With love, give me a strawberry. Okay, when you're practicing with your friend, with love, give me a strawberry. Now in the exam, because you missed out the connecting sentences, with love, I love strawberry, it's already wrong. It doesn't make sense. Okay, so you should actually read the bigger textbooks to actually connect. If you're a very slow reader, then keep it to 2 textbooks. Okay, you can keep it to the standard textbook and maybe another textbook that may be dodgy, or another smaller textbook, or even, who knows, who in this world has a textbook that can be used by medical students, and a lot of students have actually used them. I wonder who. Anyways, so actually keep to the relevant textbooks, and then actually do the relatable questions. Go online, actually do the Quizlets. There are many Quizlets online. With this technological era, it's very easy to actually pass in medicine. It's not like 20 years ago when if you were studying, the only book that was there is in the library, and if you go to the library you find out that someone has stolen the pages of the chapter, then that's it. If you missed the class, then that topic is gone and you failed the exam. So it's a bit different, because information now is everywhere and everyone wants you to succeed. I want you to succeed. I don't know about other people, but I personally want you to succeed. So actually go and do the Quizlets. You can also actually take other quizzes online. You can actually take a lot of these things, which leads me to the last and the 5th final point. actually take practice exams. I am working so hard to actually introduce premium content on my channel, to actually give channel members a chance to actually take these practice exams. We'll be setting these practice exams on different websites. Of course, you need a little bit of some connections to actually get to these websites, if you know what I mean. So I'm going to be setting actually these exams, these practice exams, and they actually grade you automatically. I won't tell you how I'm going to do it, but you will know. Trust me, you will know. I'll not mention it here because the feds are watching and everyone is watching, but you will definitely know about these practice exams. And of course, when you take these practice exams, then you grade yourself. It will even give you a comment at the end about how well you should be doing and what things you need to improve on. And I'll strive to actually make it a lot comprehensive and rather topic based. What we shall do is that we shall have different topics during the week. Like for example, if today is cardio week, it's cardio week for pediatrics, internal medicine, obstetrics and gynecology, surgery. If you really love this idea, just comment yes, yes, yes in the comment section below. And that is indeed the fifth thing, is to know what you need, or actually, I think I'm confused now. 5 things to know what you don't really know in the clinical rotation. Anyways, if you enjoyed this video, please consider subscribing to the channel. Hit the like button for the YouTube algorithm. Also drop a comment in the section below, and don't forget to tell a friend that we are back to the recording space. Can we get a drum roll, please? Actually, no, not a drum roll. Cheers. Yeah, so we're back to the recording space. And if you really enjoyed this video, please consider subscribing. My name is Dr. Moses Kazevu. I'll catch you in the next episode. Until next time, bye-bye.